Hi, everyone. If you're just joining and you want to start getting ahead on our pre-webinar surveys, we would greatly appreciate it. The links are here, one for patients and caregivers and one for healthcare providers. We'll get started in just a minute. All right. Hi, everyone. We'll go ahead and get started. I'm going to leave these pre-survey links up for just another second. They will also be shared in the chat. If you could please fill them out, they really help us inform the content for these programs and make sure we're delivering high quality content. So we'd appreciate it if you could fill out these pre-surveys. There's one for patients and caregivers, and there's one for healthcare providers. So they're here to scan. I'll leave it up for a couple more seconds, and then they will be shared in the chat. Okay. So for healthcare providers specifically, I will email this information to you after the session, but we have had a new process that we are going to try to work into our system with Boston Children's Hospital, who is giving us the continuing education units for this session. So this is the process. There is one process for returning users and one for first-time users. If you want to screenshot this, I'll leave it up for a couple more seconds. It will be showed again at the end of the presentation, and I will email you, but this is the fastest way to get your certificate, is to log in with your account with Boston Children's and then to text the code to check yourself in so that your transcript is automatically available after the session. The web link is here. It's dme.childrenshospital.org, and you can find instructions on how to register if you have not already done so on that page. But again, I will share this multiple times, so don't worry about it if you don't get it all right now. Okay. So with that, we will start with our programming. Welcome to our second Culinary Medicine webinar of the year, which is on smart savings, gluten-free diet on a budget. We know that financial constraints is a significant challenge for those who are following a gluten-free diet for celiac disease, and we want to help provide some practical strategies to help navigate this. And so we have a wonderful team here today. We have Sharon Weston from Boston Children's Hospital, as well as Dr. Nandu from Boston Children's Hospital. So before we get into that content, I just wanted to say thank you to Shar for sponsoring these sessions and allowing us to host the presentations. And we do offer translations in Spanish and Portuguese. So if you would like to listen to the translated version of this content, we have live interpreters here. Please click the globe icon and choose your language to get started. Okay, so as I already mentioned, we have Dr. Nandu here from Boston Children's Hospital. Nan is a pediatric gastroenterologist. We also have Sharon Weston from Boston Children's Hospital, and Sharon is a pediatric dietitian. So they are going to be delivering the majority of the content today. We also have a special guest, Chef Molly Winston, who is a registered dietitian, actually based out of Italy, but she is going to share some amazing recipes with us that are budget friendly at the end of the presentation. And with that, I'll turn it over to you, Sharon. Or yeah, and Nan.
I think I need to get a request fulfilled to share. All right.
Perfect. I will start. So good afternoon, everyone. Our topic, as we discussed, is smart savings, gluten-free on a budget. I'll be starting things off, and then Sharon will be taking over after. Next slide, we have, so Sharon is a consultant to Nutrica and Cape Farms, but there are no conflicts of interest related to today's presentation, and I don't have any conflicts of interest. Next slide, we have quite a few objectives to review, but I promise we'll go through them efficiently, and just kind of wanted to break it down in terms of defining the scope of food insecurity, what's the impact of it on child health, the impact specific on pediatric GI disease, specifically celiac disease, highlighting benefits of universal free lunch, and one of the kind of approaches you can use to help alleviate food insecurity a little bit, and then practical tips and cost-effective strategies for maintaining a nutritious, gluten-free diet, and then also to briefly review federally funded food assistance programs. Next slide, please. So to address our first objective, I think it's super important to at least define what we mean by food insecurity, and it's the U.S. Department of Agriculture defines it as lack of consistent access to enough food for an active and healthy life. On the map that you see kind of on the left, which is over like 2020 to 2022, actually all of the counties and congressional districts are home to people facing hunger. So this is not localized to one area of the United States. Many of your neighbors may be having this. You yourself may also have food insecurity. They also found that food insecurity among Black or Latino individuals is higher than white individuals in over 9 of the 10 counties. And in some counties, childhood food insecurity rates are as high as 40%. So I think we're truly establishing here that this is not an uncommon issue, and it is something that we can see in many neighborhoods across the United States. Next slide, please. And we also know that 1 in 3 people facing hunger are unlikely to qualify for SNAP, which is one of the governmental benefits, because after accounting for state-specific gross income limits. And there's quite a few that are at high risk, including immigrants, those who may be less educated, single parents, and those large families. And I think I find this number also quite powerful in that basically 13 million children in the United States are food insecure, and 49 million people turned to food programs in 2022. And we know that 100% of the US counties have food insecurity, like we talked on the slide before. Next slide, please. So there's many different ways on how you can screen for food insecurity. There's some long 7-question, 12 questionnaires. What we use in the clinical setting is 2 questions called the Hunger Vital Signs Screening Tool, which asks within the past months, we worried whether our food would run out before we got money to buy more, yes, no, or prefer not to answer. And then the other question is within the last 12 months, the food we bought just didn't last and we didn't have money to buy more. And if there was an affirmative response to one of these questions, it was an indication of potentially risk for food insecurity, and a social work referral was recommended. And this was based off of the amazing work of Hager in 2010, which kind of validated the screener based on some of the longer food insecurities. I mention this because we'll use this and reference this kind of through some of the research that is indicating kind of connections between food insecurity and some health outcomes. Next slide, please. And that's actually what I'm going to move to next, where we look at what we have found that actually, from a research standpoint, we know that children from food insecure households have been associated with increased risk of obesity, developmental delays, issues in school, depression, suicide, illness, and even increased hospitalization. There's also been studies that have shown that there's decreased nutrient absorption, resiliency, decreased medication adherence, and even like issues with disease management. So there is a huge medical and health reason to care when children are coming from food insecure households. Next slide, please. To kind of narrow our focus just a little bit more, I also want to highlight that especially in pediatric GI, we often use food as medicine. And this is a pretty broad term, and so let me just give you a few specific conditions to think about in that case. For instance, you can think about it where certain children may require specialized formulas in order, such as in like milk protein allergy for their treatment. But it food as medicine can also mean, such as with celiac disease requiring a gluten-free diet, or those with irritable bowel disease, sometimes you recommend something called a FODMAP diet, where you're decreasing certain types of foods, or even those in EOE where you try and go dairy-free, um, gluten-free as well. And so oftentimes food is the actual treatment for some of these pediatric GI disorders. And so from the next slide, I'm going to just actually directly connect one of those conditions, celiac disease, to food insecurity. I know you guys are all familiar with celiac disease, and many of you are probably familiar that gluten-free foods are about 2 to 10 times more expensive than gluten-containing counterparts. In the study on the left, which was done by Lee et al. In 2019, so we are a few years out of date, I will preface that. So this, I think, might be even more extreme. But and the orange is those with gluten containing, and then the gluten-free are those on the blue. And so you can really see that even like when you compare product to product, there is a huge difference, which I know many people see on their weekly receipts as well. And the other important thing is state and federal food assistance programs do not currently account for this increased cost of the gluten-free foods. And so even if you were to qualify for those supports, it does not accommodate the fact that your food may just be more expensive item per item. Next slide, please. I also wanted to give you another reason why we care about food insecurity. I'm going to briefly review an electronic survey that was sent out to families of children with celiac disease through a celiac support group over a 3-month period. This was done over the COVID pandemic as we're kind of interested to see how food insecurity and this newer term that I haven't quite told you too much about, gluten-free food insecurity, kind of change. We had 378 households with children with celiac disease who answered, and in this group, we found that overall food insecurity and gluten-free food insecurity did increase during the COVID pandemic. While not a significant difference, you can see the general. However, what was more important for us to learn is that there's actually a need to screen specifically for gluten-free food insecurity, where we did the hunger vital sign questions, the same two, but we actually added gluten-free food as well. So patients were asked basically 4 questions instead of 2, and we found that 1 in 20 households were found to be food secure, but then screened positive for gluten-free food insecurity. So the hunger vital signs may not actually identify all of those in the celiac population who may require additional supports to help address like food insecurity. On the next slide, I'm really demonstrating kind of the importance of food insecurity and its role it plays in the health of children with celiac, because it became really apparent that in about 1 out of 10 households with a child on a gluten-free diet, gluten was intentionally consumed due to limited gluten-free food availability. Um, on the left, you can actually see that this also increased during the pandemic. So part of it might have been just lack of gluten-free food availability in terms of not being able to access the stores for it, or restrictions from like a shipping or manufacturing standpoint. But either way, um, what we did find was that there was an odds of intentional gluten ingestion increased if there was a positive screener for food insecurity. So really, this directly relates to how you're able to, um, given that the gluten-free diet, as many as you know, is the only treatment for celiac disease at this time, for you to be able to adhere and follow the treatment was directly impacted if you had food insecurity or not. So next slide, please. Uh, Looking also a little bit closer, there are quite a few nutritional concerns for food insecure patients with celiac disease. As we discussed in the prior slide, we demonstrated in our study that there is reduced adherence to the gluten-free diet, which can really due to the risk of intentional gluten ingestion. There's also a thought that lower nutritional quality of meals and snacks, because they might be more processed, or you're going maybe for cheaper options in order to try and get enough food, might be lower quality. And also just in general, gluten-free foods are less fortified in general compared to their gluten-containing counterparts. So that could put individuals at further risk for nutrient deficiencies. And then there's also just a limited access to a variety of foods. So I think like that huge star on the right really summarizes what I've been trying to establish for you guys to set up Sharon, is that if a patient with celiac disease can't access gluten-free food, then they cannot treat their disease. Next slide. And so I've kind of now explained that there is a problem or there is something that we should try and address. And so I didn't want to kind of leave without at least mentioning one of the interventions that is important for us to kind of get the word out, as it may help play a role in addressing some access to food. And one of it is accessing universal free school meals. As many of you know, in August of 2023, Massachusetts joined 7 other states in passing laws to make school meals for all permanent. And universal free meals account for up to half of the students' daily nutrition. And so access to gluten-free meals in school should be documented in a formalized accommodation plan. And it really kind of represents an area where we could get access to food for individuals because they qualify for it, and because it's already included in like school budget. I'm just going to briefly review one quick study that we did in terms of trying to figure out what were the barriers for children with celiac disease in participating in elementary school meals. And we found that many of them lacked trust and confidence in the school cafeteria, and we're currently trying to build resources for school food service staff to be able to be trained to provide gluten-free food. And I think this really highlights the importance of education and getting the knowledge out there, because we found that 50% of families with a positive screen for food insecurity were not partaking in the free school lunch and breakfast, which really highlights an underutilization of this resource for families of children with celiac disease. Next slide. Sorry, I might have jumped a slide, Sharon. And so I think I'm going to transition over now to Sharon, but I think overall that gluten-free diet can be both healthy, budget-friendly with a little planning and creativity. And I think Sharon's going to go a little bit more on kind of different techniques that you can use to get there.
Thank you, Dr. Du. Yeah, so I'm just going to kind of transition here to, again, focusing on how we can achieve a healthy, budget-friendly, gluten-free diet and not drive ourselves crazy. And so really just focusing on whole foods, smart shopping, using resources that are available, planning ahead so that we really don't sacrifice nutrition. So first off, just thinking about the hidden costs that are involved in understanding how we can achieve a gluten-free diet. So the hidden costs really are really broad. And so some of the things to think about are, first off, gluten-free products tend to be more expensive, as Dr. Du showed, due to probably like things like specialized production. Companies have to pay more for certification. Also, transportation can be another hidden cost where you have to drive farther or get somehow to a specialty store that sells specialty products that are gluten-free. Also, we know that gluten-free packages are much smaller. The servings per container are smaller than their gluten-containing counterparts, so you don't have as much food for more money or cost for that product. For example, when you compare a loaf of bread that's gluten-free to a regular loaf of bread, it's much different in size. Also, there's hidden costs associated with special ingredients or special tools that we might need to just make the recipes work. And also that falls into the same kind of principle with extra cooking tools that we might need just to minimize cross-contamination. So some budget-friendly strategies for gluten-free eating, first off, are to really take advantage of those naturally gluten-free foods. We really want to emphasize that. So really encouraging staples like potatoes and sweet potatoes and corn and quinoa. Also naturally gluten-free protein sources, things like eggs and legumes and lentils and poultry and fish and tofu. Also fruits and vegetables. Awesome to take advantage of those naturally gluten-free foods and really bring them into the whole nutrition picture. Also, shopping smart is another important strategy. So taking advantage of resources like SNAP, WIC, local food banks, farmers markets, looking for sales, looking for coupons for gluten-free brands online or like in flyers, and also even taking advantage of different budget-friendly stores. So going to places like Job Lots has a lot of gluten-free products in there that you wouldn't expect. I think it's important to always make sure that you're looking at the expiration dates when you go into those discount stores to make sure that you're buying something that isn't going to expire soon, and that's also going to last longer on your shelf. Also, minimizing waste is another strategy. So repurposing leftovers, really taking advantage not to throw anything out. So if you're cooking with a can of tomato paste and you only need 1 or 2 tablespoons in a recipe, what do you do with the rest? You can freeze it in an ice cube tray and then pop it out and put it in a Ziploc bag and use it for future recipes. Important strategies like that. And also storing your products properly so that you extend the life of the product. You can stick these things in your freezer to extend the shelf life. Affordable alternatives is another strategy. So thinking about different gluten-free options that can be cheaper than specialty products. So like using a corn tortilla instead of gluten-free bread. And then batch cooking and scratch cooking is something that we promote a lot in this culinary medicine series. So really thinking about scratch cooking. Scratch recipes are going to start from the beginning, and instead of using processed foods, it's healthier, it's cheaper. You can keep it simple, and then if you double or triple your recipe and make a big batch, then you can freeze that to take out of your freezer when you're short on time for future days. And this is just an example that I put together of a home cooked meal versus a store-bought prepackaged version, and you can see that the amount that you can save for 4 people to feed is significant, and also just the quality of the food, the minimizing risk of cross-contamination or using ultra-processed foods is going to be a lot different when you scratch cook instead of use processed foods or prepackaged foods. We also want to think about balancing nutrition on a gluten-free diet. And so some important nutrients to think about that we know are sometimes deficient because of gluten-free foods not being fortified are iron. Also, we want to think about calcium and fiber. The gluten-free diet can be low in fiber. So foods to really focus on that are iron-rich are going to be things like beans and lentils and fortified gluten-free cereals. Calcium-rich foods can come from leafy greens and dairy or fortified non-dairy milks. And then fiber-rich foods include things like vegetables and fruits, nuts, and seeds. So I put together this 2-day gluten-free meal plan just to kind of walk through different meal ideas and how we can think about cost-saving tips. So for example, on day 1 for breakfast, if you had banana oat pancakes, you could do some cost saving by buying unbranded gluten-free oats and then using ripened bananas that you can find sometimes in grocery stores that are on the sale rack. And you can also, if you feel like you have bananas that are getting too ripe in your home, you can just peel them and stick them in a Ziploc bag and freeze them to be used for recipes. Also for lunch, rice and black bean bowl, you could use dried beans to save money instead of canned. For a snack of veggies and hummus, you could make your own hummus. Very easy, just throw in some chickpeas and some garlic and olive oil into a blender. You can add tahini as well, but it's not necessary. For dinner, if you had chicken drumsticks with cherry tomatoes and sweet potatoes, you could roast this all on a sheet pan for efficiency, and you could buy the chicken in bulk or on sale and freeze some of it. On day 2, for Greek yogurt parfaits, you could choose store-branded yogurt and seasonal fruits for affordability. A quinoa salad with chickpeas and vegetables could, again, take advantage of dried or canned chickpeas and frozen vegetables. Apple slices with peanut butter, you could get your apples in bulk when in season. And then finally, stuffed bell peppers, you could use leftover rice from a previous meal and then shop for ground meat on sale. So we also really want to take advantage of our food resources. So this would include things like SNAP, WIC, the school lunch program and summer food service program, and then also food banks, food pantries, and kitchens. And we know that there are, as Dr. Du mentioned, that there are barriers to accessing assistance programs. And so many adults that qualify for assistance programs don't access them because of different reasons, like lack of knowledge of programs or concerns about immigration status or transportation issues, language barriers, stigma, and even just the process can be sometimes complicated to fill out. But we really want to try to encourage our families to take advantage of these resources. And the first one that's really helpful is SNAP. SNAP is the strongest single line of defense against food insecurity. It's the largest food-related entitlement program, and 47 million people are using SNAP. 72% goes to families with kids. And when children have access to SNAP, we know that the risk of developing things like high blood pressure and heart disease and diabetes and other poor health outcomes later in life greatly decreases. And this is just goes over SNAP eligibility. It's varies in state by state. And what SNAP can buy, this is in Massachusetts, but SNAP can buy fruits and vegetables, meat and poultry and fish, dairy, breads and cereals, other foods like snack foods, seeds and plants that produce food for being able to eat. So like herbs, for example. And then there's the HIP program, which is the Healthy Incentive Program, that you can actually get more money by buying fresh fruits and vegetables and taking advantage of farmers markets. But you can't buy some things with SNAP. So the things in red are listed here, things like alcohol or cigarettes or medicines and pet food. And then we have WIC, so the Women, Infant, and Children Program. WIC is designed for pregnant women and families with children under 5 years old. It's overseen by the USDA. It provides breastfeeding support and nutrition education. And the food packages for WIC are a little different than SNAP. They focus on emphasizing healthy foods. And so WIC is going to offer nutrition and health screening and assessment, nutrition education and counseling. It can make referrals to related health and social services, and you get the EBT card just like SNAP. It's very convenient, and also they provide coupons to use at farmers markets. WIC foods include things like whole grains, soy beverages, canned beans and potatoes, canned fish, peanut butter, juice, milk, milk alternatives, yogurt, and so it's really covers a broad variety of healthy foods. And there's a really convenient WIC app that you can use on your phone, and that makes it very easy to use the shopper app when you're shopping. You can just scan barcodes, and you can also find grocery stores that will accept WIC, and it will tell you your balance and also provide some other healthy recipes and healthy resources. So using WIC and SNAP together is really the way to do it. So so first you can kind of make a plan of what your WIC products that you're going to use your WIC for. So things like cereals and peanut butter and milk and yogurt and bread and eggs. Unfortunately for gluten-free right now, bread is not an option with WIC, but you could use things like for corn tortillas even. And then for SNAP, you would want to use SNAP to fill in the holes. So things like oil or staples that are not covered by WIC. When you check out, you always want to use your WIC card first, and then your SNAP card second. Okay. And then besides the SNAP and WIC resources, there are other resources that we really want to encourage taking advantage of. So these are things like the school lunch program. The backpack program is another option that is available when school's not in session. There are some school pantries and summer meal programs as well that kids can take advantage of. Also, there are food pantries that we really want to highlight. And so this picture here is the Boston Children's Hospital Family Food Connections Pantry. This was a idea that was really identified by providers and social workers and staff across Boston Children's Hospital, and really addressed barriers that families were facing in terms of accessing gluten-free foods, because the Family Food Connections at Boston Children's has a referral for our patients with celiac disease to access the pantry and get gluten-free foods even weekly there. And so we can track usage and outcomes, and it really recognizes the positive connections that are in our community that can be made through food. So right now, just some things that are offered by our food pantry. which is adjacent to the Martha Elliott Health Center in Jamaica Plain, or that families can go there once a week to pick up food. There is gluten-free bread, pasta, crackers, pizza crust, and snacks available, as well as a lot of fresh produce. So lots of fruits and veggies, rice, dairy, eggs, and then we do the free monthly cooking class that's associated with the food pantry, and information is entered into the electronic medical record. Some just metrics on the food pantry to date are that over 4,300 families have visited in the last year. The site has over, actually, I think it's more like 1,400 visits per week now. 120,000 bags of food have been distributed. More than 80% of the families who visit have a child under the age of 17. Between 200 and 450 families are visiting the site on the days that it's open. Right now, we've got 252 families that have a member following a gluten-free diet, and we go through about 125,000 pounds of food per month. Almost 75,000 pounds is just fresh produce. We do know that there are some barriers to preparing healthful gluten-free meals, and those would include things like, first off, limited access to gluten-free ingredients. Like as Dr. Du said, if you can't get ingredients that are gluten-free, it's really difficult to make a gluten-free recipe. So the food pantry is really awesome to provide our patients with those gluten-free ingredients. Other barriers to preparing healthy gluten-free meals would include things like limited knowledge of recipes and also how to do those recipes in terms of technique, limited acceptance of recipes, just because sometimes the gluten-free recipes just don't taste the same as recipes that had gluten in them. And also we know that ingredients just don't seem to last as long when you're using gluten-free products. So the gluten-free cooking classes that we do are virtual. They're by Zoom once a month. They're recorded as well. And just in terms of our average views, typically per class are over 120, and our highest views are a little over 200. And each month we do different topics or themes. So those go along with the 3 different recipes that we highlight. And it makes it fun. It makes it a great learning opportunity for those who attend. And we're really creating a nice bank of recipes that are accessible to all of the families, that they can go back and look at the history of the videos that are recorded. And I'd like to just end by saying thank you.
Great, thank you, Sharon. Okay, with that, we will transition to the cooking part of the presentation. So we do have Chef Molly Winston on the line to answer questions that you might have about the recipes, but just to go through the recipes themselves a little bit more in depth, here is the ingredients that we are using for a delicious looking chickpea salad. There is a link to it that goes to our website, and you can download it and print it out if you are interested in the full recipe instructions. We also have the nutrition facts here as well. And I will play a little video to show you how to make it.
All right, let's get rocking and rolling. This is Chef Malls, and today we are making a gluten-free Greek-inspired pasta salad with char penne. This is super healthy. It's packed full of protein. It's really easy to make, and it's fantastic to make for a crowd. So we've got, in addition to our char penne, we have some canned chickpeas, just drained and rinsed. We have a whole bunch of vegetables here. We've got some chopped cucumber. We've got some chopped tomatoes. I've got some yellow and some red ones today. We have some finely minced or chopped parsley and some red onion, some feta cheese. Optionally, you can add some kalamata or black olives. I'm going to leave them on the side, but if you'd like to throw them in, I love them. My partner does not, so I'm going to leave them on the side. And I also have a dressing here, which is super simple: olive oil and some red vinegar, oregano, salt, and pepper. So we're just going to get everything mixed together here. So you want a big bowl for this so you can mix really, really well. I'm going to add in my chickpeas right in there. And then I'm going to add in my tomatoes. I love the color of this salad too. It also keeps in the fridge really, really well. So this is something you could make for meal prep that would really last the week, which is fantastic. I've got my cucumbers in. I'm going to go in with my feta cheese here. Look at that, so beautifully crumbled. Something else that's great about this recipe is if you have other vegetables, throw in some bell peppers or some carrots. That would also be delicious in here. We've got our red onion. And also, if you don't like one of these things that I'm putting in, you don't have to use it, which is also fantastic. So next I'm going to go in with our parsley. Already this looks so pretty and it smells so good. I'm going to start giving this a big mix, and we're just going to really incorporate everything really well together. Everything is really well incorporated, so we're going to pour in some of our dressing. You can make your dressing in a squeeze bottle, a mason jar, anything you can shake. Just give it a nice shake before you pour it in. And between our dressing and our feta, we're probably not going to need any other seasoning here. There's plenty of salt going on, plenty of flavor. You can always taste for salt and pepper and see if you need to add those as well. So you just give everything a nice big mix, and this is your finished product. It is so delicious. You're getting lots of protein in there from the chickpeas. You're getting all sorts of micronutrients and some fiber. You've got all those veggies in there. The sharp pasta is delicious, and it absorbs that dressing, and it tastes so good. And I hope you try it.
Great, thank you. The recipe is beautiful. It has so many colors, which I love. It incorporates a lot of budget-friendly ingredients, and there's a lot of ways to adapt it, which is really great. So if there's an ingredient you want to change out, this is a easy one where you can add things you really like to personalize it. Molly was kind enough to provide us with a bonus recipe. So this is a loaf pan chicken, which is a super simple recipe to make. So I did want to share it here. There's again a link and the nutrition facts to the recipe here, which you are welcome to scan. And I have Molly, I did take your video from your Instagram
So
to
I got
show
a lot of
this.
questions recently on social media about my loaf pan chicken meal prep. So here is how to do it. I started with some really thinly sliced chicken breasts, sort of like cutlet style, and I marinated them in olive oil and spices. You can marinate whatever you'd like. Now, just with my hands, I have my loaf pan. Mine was silicone, but you can use a metal one as well. And I just sort of crinkled the slices of chicken into this pan. So I just sort of pushed them in there with my fingers and made sure they were all nestled in there because it's going to stay super moist. The chicken's not going to dry out this way. They're not layered. They're just sort of folded up next to each other. So after it was all sort of dimpled and everything was in the pan, I baked it at 375 for about 25 minutes. And then I let it cool a little bit. You'll get some liquid on the sides of the pan. You can save that for chicken broth, or you can get rid of it, up to you, or you can let your chicken sit in it. And then it cools a bit, you take it out of the pan and you slice it up, and you have the most wonderful chicken for salads, for bowls, for soups, anything you need. So enjoy.
All right. Thank you, Molly. I just had to share that one. It was such a good idea. Okay, so we are at the point in the presentation where we are going to start opening the Q&A. So if you have questions, please type them in the Q&A box. In the meantime, again, we ask that you take the time to fill out our post-webinar surveys. If you are a healthcare provider claiming credits, we still need you to fill out this survey in order to make sure that your certificate is logged properly. So please, if you are a healthcare provider, fill out that survey. And for patients and caregivers, again, this will help us inform the quality of the presentations moving forward. There is a slide, again, showing the Boston Children's Hospital process. I will email this to you, so don't worry if you don't grab it all. But if you had the time at the beginning of the presentation to sign up and get yourself checked in, this is just a repeat of that information. And last but not least, upcoming programs. We have a couple more of these scheduled already for June and August. The June presentation will be on understanding gluten exposure risks and clinical trials, which is going to be presented by Dr. Vahe Badalian. And then in August, we have a presentation on parenthood, fertility, pregnancy, and breastfeeding, which will be presented by Dr. Maureen Leonard and Jessica Lebovitz, who's the dietitian at Columbia. So you can sign up using the link here. All right. I will leave this up for just a few more seconds so people can go to the link, but we will also share it in the chat. Okay, so I guess with that, we will start the Q&A. So Sharon, I think this was in your presentation. The first question is about oats. What are the unbranded gluten-free oats that you mentioned for cost savings in your presentation?
I think that you have to be careful with oats just to make sure that they're gluten-free, obviously, right? Like Vitacost is one that I've come across that's been pretty cheap and gluten-free. Also, you can buy larger bags of the branded ones and look for sales. And I think that, again, like going in those like job lot stores, discount stores, you can really find some good bargains there.
Yeah, and would you mind, Sharon, just giving a short overview about oats in general and their inclusion in the gluten-free diet?
Sure. I mean, oats are a great nutritious inclusion in the gluten-free diet, right? They give us, they're one of the highest protein containing grains. They're very versatile in a lot of different recipes, and they taste good and they're easy to find, right? And you can grind them up and you turn it into flour. You can just use oats in so many different ways. And so it's great for including in the gluten-free diet to give us more options. Oats, first off, we have to be careful about the cross-contamination concerns for oats, because oats are grown in fields near wheat and barley and other gluten-containing grains, and farmers do crop rotation and move grains to different fields. And so you need to make sure that the oats are gluten-free, and that's either done by purity protocol, that manufacturers start from scratch with gluten-free dirt, seeds, the whole harvesting process, manufacturing is completely gluten-free, and then they test it in quality control to make sure it's less than 20 parts per million. And then you've got the mechanical optical sorting method that is more of a cleaning process that really relies on cleaning and also quality control. So it's, if they're really being strict about their quality control and frequent, then that improves confidence for the consumer that that product is going to be gluten-free. The other issue with oats is that they contain a protein called avenin, and avenin is a little troublemaker in some people that have celiac disease, and it can create an inflammatory response that isn't the same as the damage that gluten does to the gut, but it still might not make you feel good for a little while. And so, and also oats are also a FODMAP, so they're a fermentable carbohydrate, which can create gas and bloating, and some people that are sensitive to FODMAPs can have issues with oats in that way. So balancing oats with other things is good, and using them in moderation, and being aware that if you have symptoms with oats, talk to your GI team and really discuss that.
Yeah, and there's another question about our unbranded oats labeled gluten-free. I think our general message would be you should always be looking for a gluten-free label on your oats and your oat products. So even if they're not necessarily branded, you still want to look for that gluten-free label. Okay, are the school meals you discussed free? And if not, can you please explain?
Sure. So I apologize if anything was garbled or not clear, but in our survey research study, we did it specifically looking in Massachusetts. That's the data that I showed. The second study, looking at the opinions of families in Massachusetts with a child in an elementary school. And actually, at that time, all public schools in Massachusetts have free school lunch and school breakfast. So the survey results for that study was all in those who had access to free school lunch. And so we were specifically looking because we were saying if everyone can get it, why are people still not using this resource? I think there are, as we mentioned, there are 7-8 states who also have free school lunch and breakfast. And so for those, everyone is receiving it. Now, in the states who don't have free school lunch and breakfast set aside, there is still lunch and breakfast provided for, but you have to meet a certain kind of economic / like household salary amount. It has to be less than that for you to qualify. And so there are additional barriers in terms of registering for that, potentially like feeling ostracized, or if you're the only one who's getting the free school lunch. And so there is actually a lot of research in terms of barriers to that. So we tried to kind of remove those from our study and really strictly look at a population that already has access. Hopefully that answers the question.
Thank you. Okay, this next question, it might, I think this could be its own session, but when reading labels, can you give a quick training on what to look for? There's a lot of conflicting messages out there. So I don't think we have time to do a full training on this, but Sharon, if you could give a few quick tips, I think that would help.
First, I just have to say there's a new app that is causing like havoc with some people, and I want to just inspire everyone to chill and not worry so much about these ingredients that have been generally regarded as safe, and now are all of a sudden everybody thinks we're all going to die. But I think that it is always good to look at the ingredients, and when you see a lot of ingredients, like more than 5 that have a lot of artificial ingredients, things like that are artificial colors, artificial sweeteners, all of that stuff is not going to be as nutritious for us as eating things that are from the earth and 100% natural. So, but again, everything in moderation. So I think that, just looking at the ingredients, count up the number of ingredients, look at the first 3 ingredients. That's the biggest volume ingredients that are in that food. So those are your big things, right? And then it's also, I think, helpful to look at the daily value percents. And when you look down at the nutrient label, 5% or less would be something that's low in that nutrient. So if you see calcium and it says 5%, that's not really going to give you that much calcium. But if you see something that's 20% or more, then that's high in that nutrient. And so if you see 23% calcium, that's great. So that's kind of a good way to look at food labels, I think.
Yeah. And of course, verifying that all of the ingredients listed are in fact gluten-free. And the best way to learn that is to work with a dietitian like Sharon, who has been doing this for years and years and can give you really important information about how to identify gluten on a label. So the next question is about school meals again. So how do we advocate for better options for gluten-free school meals?
I can start. I think that we didn't touch a lot on this in my slide, but another thing that we found in our study is that a good portion of actually the students did not have a 504 plan in place. And what a 504 plan is, kind of an establishment with the school and the family of kind of accommodations that can be set aside for a patient who has celiac disease. And a component of that is making sure that they have gluten-free school lunches and breakfasts available. And so I think probably one of the first things is kind of making sure the school is aware that the child has celiac disease, so then they can also then prepare from a resources standpoint to know that they have gluten-free foods. So I think that's the first step, and that's also something that you should talk with your pediatrician/pediatric GI doc, because they can write you a formal celiac diagnosis letter, which can be super helpful when negotiating kind of the 504 plan stuff. And I know also our Amazing Celiac Disease Foundation does a lot of stuff in terms of advocating with schools and 504 plans. So I will not talk too much on how to set that up. And I think the second thing is I think there's power in numbers from a community standpoint as well with schools. And so I think advocating with not just those with celiac disease, but maybe those with allergies and those who have other restrictive diets can be also very empowering to make sure that your voice is amplified. I think in general, school lunches, they can be improved from a nutritional diversity and kind of attractiveness standpoint, but they are working on that. And so I think there are other initiatives to kind of work on there. But I think it's kind of amplifying your voices with other individuals and to making sure the school's aware. And I'll let you also chime in if there's anything I missed.
I agree. I think that that just really encouraging the 504. A lot of families will ask, "Oh, isn't an IHP just as good as a 504?" And the individual health plan, the IHP, is just not a legal contract between the school and the family like the 504 is. And so so really encouraging families to get that 504 in place is really important.
And I believe Emma just shared a link in the chat, but we do offer, in partnership with Boston Children's Hospital, a monthly school support session where we go through the 504 plan in great detail. And we do talk about ways to speak with your school about finding better options in a school setting. So we'd highly encourage you to join that. They happen every month, and we have them, we have different topics that we kind of loop in as different things come up. So definitely join one of those. Okay, and I see one more question in here. I haven't been able to find gluten-free product coupons. Is there a good resource you can recommend for finding these? So just broadly speaking, every company is going to be a little bit different. My suggestion is to sign up for the company's mailing lists because they typically will provide coupons to their own subscribers. But Sharon and Dr. Du, I don't know if you have any other tips.
I was going to say that that when you sign up for emails or you just go on the manufacturer's sites, you'll be able to get coupons that way. So Char, Udi's, Bob's Red Mill are just some examples. And then also stores will feature coupons in their weekly ads for gluten-free foods. So like Target and Walmart, for example, will be two good stores to check out for that. Whole Foods also, I think, has discounts for gluten-free items for Prime members. And then there's other stores like Safeway and Kroger that also include gluten-free food coupons in their flyers as well. So just checking out the weekly flyers is helpful. Yeah.
Great, thank you. I think we have addressed all of the questions. So everyone who is seeking a certificate for your continuing education credits, please be on the lookout for an email from me. We will try to help you get your certificates very quickly. And thank you everyone for joining, and thank you to our speakers. This was a great presentation.